It's been more than 5 months since the news of coronavirus broke the world over, throwing the world stage into a despondent atmosphere. This, of course, requires a high mental, physical, and healthy balance to pull through. This is our focus today on sound health. I am Olasumbo Modupe. Welcome to the show.
Evaluating the phased lockdown, the Presidential Task Force for COVID-19 has emphasized that there is no way the country will achieve the intended gains of the guidelines and directives issued for the phased lockdown if people fail to comply with them. The Presidential Task Force has appealed the guidelines do not have the force of automatic operation unless they have to be obeyed. The chairman of the task force said the outcome of the surveillance points to the fact that violators are still rampant and portends a very dangerous trend. The PTF affirmed the need to strengthen enforcement in collaboration with the states to provide appropriate PPEs and related protective gears for security personnel. Furthermore, all exempted persons, including journalists and medical personnel, should always carry a verifiable and authentic means of identification. The PTF also disclosed that there is no fixed date for school's resumption. Assessing the phased lockdown in Lagos State, the incident commander of COVID-19 and Governor Babajide Sanwo-Olu says the rush recorded last week Monday was regrettable, but the state has intervened and appealed to banks to open more branches and activate other alternative channels which their customers can use. Governor Sanwo-Olu says commercial bus operators scored below performance in the level of compliance, but the state will continue to work with them and hopefully in the next few days there will be significant improvement. 2 facilities in Badagry West LCDA of Lagos State have been shut for contravening new guidelines issued by the government to operators of hotels, clubs, and other entertainment outfits in the state. The governor also announced that more isolation centers will be open to handle COVID-19 patients in the state, as there will be introduction of community management of moderate cases through the accreditation of primary healthcare centers. Sanwo-Olu added that 4 more testing facilities are running in Lagos State as the combined lab capacity is at about 850 tests daily. The state government, through its Ministry of Health, has debunked the reports making the rounds suggesting that the Commissioner for Health, Professor Akin Abayomi, has tested positive to COVID-19, describing the news as absolute falsehood fabricated by mischief makers. However, it was disclosed that 10 persons associated with the Lagos State House in Marina have tested positive to COVID-19. The state government implored all to continue to embrace the Mask Up Lagos initiative and observe all precautionary measures such as physical distancing, hand washing, and other personal hygiene. 3 new laboratories have been included in the country's laboratory network for COVID-19 testing at the University of Port Harcourt Teaching Hospital, Rivers State University Teaching Hospital Satellite Lab, Port Harcourt, and the University of Benin Teaching Hospital, PCR Laboratory, Benin. This brings the number of laboratories in Nigeria with the capacity to test for COVID-19 to 23. Meanwhile, the World Health Organization has deployed a rapid response team to support Kano State government in the fight against COVID-19 following the increase in deaths. WHO also called for clinical trials of Madagascar's COVID Organics, a herbal drink that is said to prevent and cure patients suffering from COVID-19. Till date, over 4 million confirmed cases have been recorded globally, with more than 4,000 cases in Nigeria and above 51,000 confirmed virus cases in the African continent. The public are advised to stay at home, use face masks, practice social distancing, observe the highest possible personal hygiene, and report suspicious cases by calling 08000 NCDC on 080-097-000010 or the 3 telephone numbers whistleblowing purposes during the phased easing of the lockdown in Lagos. The numbers include 090-105-13197 or 090-105-13198 and 090-105-13199.
was the weekly update on COVID-19. We are now being joined by Dr. Leonard Okwonkwo via Skype. Dr. Okwonkwo is a clinical psychologist and will be taking us through how to achieve mental balance during the COVID-19 era. Welcome to the show, Doctor.
Thank you very much.
Okay, sir, it's 1 week since the federal government declared a phased lockdown in Abuja, Ogun, and Lagos State to stop the further spread of COVID-19. What is your assessment of the situation?
Well, I think because of the duration of the lockdown,
Okay.
so many people were desperate to come out. And when they came out, when the lockdown was lifted, people just became very careless and carefree. And everybody rushing to the bank, rushing to the market, and so on, without taking the appropriate measures. I won't be surprised if there's going to be, an upsurge in the number of confirmed cases of COVID-19.
Okay. All right. Before now, there was a restriction of movement for about 5 weeks. Many has described this period as a time of reflection, family time, and an opportunity to rest from the hustle and bustle of Lagos State. What's your take on this?
Yeah, it depends on how you are spending the lockdown. For some people, it was a time of reflection, of rest, and so on. But for some other people, it was a time of hunger, irritability, and hunger. See, one thing about COVID-19, it brought with it an increased level of anxiety,
Okay.
fear of the unknown. And with the lockdown, this was further increased by conditions of loneliness, depression, and then hunger for some people. And when there is hunger, there is irritability. And when there is irritability, you find people quarreling, fighting, increase in crime at certain levels, and so on. So it has its good and bad parts. For some people, it was a time of reflection, of rest, creativity, but for some others, it was an ugly experience.
Okay, let's look at physical well-being and financial sufficiency during this period. Are there health implications to watch out for at this time?
Health indications, as a result of the lockdown, you mean?
Yes.
Yes, when people are isolated and asked not to go out, there is decreased mobility, people don't move around, and the result of that is people get fatter, and then the fat ones become obese. So that's one thing we're likely to see.
Okay.
Excuse me, please.
It's okay, sir.
And then when you find that kind of condition, you have increase in conditions like hypertension, diabetics, and so on, which are even conditions that can complicate the cause of COVID-19. Yeah, so there are health implications. And that's the physical side. I don't know if you understand what I'm saying.
Yes, I do, sir. Can this period also result in depression?
Yeah, that is on the mental aspect or the psychological aspect.
Okay.
Because like I said earlier, there is increased anxiety, fear. So with the lockdown, some people became lonely. And when people are lonely, they tend to withdraw into themselves, which increases the level of depression. Then when there's depression, some people try to cope with depression using drug and alcohol. So there's likely to be an increase in drug addiction and alcohol. And when you have these conditions, you are likely also to find an increase in self-harm and suicidal tendencies of behavior. These are some of the health issues or psychological health issues that we can find as a result of the lockdown.
Okay, fear, anxiety, worry for one's health and that of family members, especially the aged ones, are pointers. How do you make the best of this period?
Well, first is is to understand that anxiety itself is normal. All right, when it is at a level, all right, it is normal. It is when it becomes elevated that it becomes a problem. So the bottom line, what we should be looking at is helping people achieve a state of balance. A state of balance in the sense that don't get too much anxious, don't get too much isolated, and if we're looking at that, and we're looking at the source of anxiety, you know that one of the chief sources of anxiety is news, social media. You realize that a lot of bad news, fake news comes to social media. Avoid jumping up and down, because anxiety pushes people to want to know more. So you open everything that comes to your phone and so on like that. But if you want to achieve a state of balance, you have to put some restrictions on the kind of news you listen to, the kind of messages you receive on your phone, on your WhatsApp, and so on. Okay. And if you're able to place a balance on that, you regulate the source of fear. That is on one hand. And you can also get news. Of course, it's important to be informed. Discipline yourself to listen to one credible source of news instead of just jumping from one news to the other. Okay. And then use the opportunity to take a break. All right. Find something else to do. Find other ways of doing things. Like in the case of loneliness, of course, you have your phone. Reach out to people. People reach out to you. And before long, you find different ways you can use your phone that becomes even creative. And in terms of livelihood, there are not new ways of making money online. I know so many people who have been working from home, carrying out their activities, their marketing online, Instagram, WhatsApp, Zoom, and so on like that. So these are some of the things that we can do, all right, to bring about a balance to the harmful effect of the anxiety, fears, loneliness, and so on. And apart from that, which is very important, you do what is right. Do what is. So if you do the needful, you will get the needful. We know things we can do to avoid getting infected with COVID-19, like hygiene, social distancing, use a face mask, wash your hands, and use sanitizers and so on. If we do these things very well, then the fear and even the chances of infection with COVID-19 goes down significantly.
Okay, as an expert now, how do you cope when you are stuck at home, lonely in self-isolation, anxious, or being overwhelmed by news on coronavirus?
One, build up your relationship with God. That's one way. Like, I know something the Bible says, cast your cares on the Lord, or cast your burdens on the Lord, for He careth for you. So when you learn to put your focus, it's been found empirically that people that have or tend to put their trust in the higher being tend to survive this kind of time.
Okay.
So that's one way to do that. And then there are other ways, like listening to music, which is relaxing. There's what we call relaxation therapy that also helps to keep you relaxed.
Okay.
Keep in touch with family and friends. That will also help to reduce the level of. Then cut your coat. You are cutting to your size according to your material. Don't say, okay, there's going to be a lockdown, so you bring all the money you have, and then because you see yourself with bulk money, a lot of food at home, you finish everything, forgetting that the rainy days will be long.
Okay.
And then that again increases the level of anxiety. Okay. So if you learn to plan well and manage your life well, it reduces the level of anxiety that you're likely to experience. And of course, knowing that the elderly and those with some underlying medical conditions are more susceptible, then we should take more care for the elderly. Children don't know their left from their right sometimes. So conscious effort should be made to ensure that the younger ones who have a tendency to play here and there, touch anything, should not be too close to the elderly. And when it happens, let it be a deliberate make sure that they are sanitized. Their hands are sanitized, their hands are washed, and then because even the elderly need, some of these things to an extent, because loneliness itself can be a problem.
Okay, with the turnout of events on 4th of May, sadly, many believe the federal government will declare another phase of lockdown. What are the survival tips needed during this time, or coping tips?
Yeah, like they say, once bitten, twice shy. The first one met a lot of people unawares, and then consequently, you find them on the street begging. You've been given at least a week to prepare. This time, prepare well.
Okay.
Even if there's going to be another lockdown, make sure that you have enough that will last you, for a long time, because once it is done, you never know when it's going to be lifted. So ensure that you have enough food at home, ensure you have enough face masks, sanitizers, and so on. Even if you need to borrow, this is a time to borrow the proper kind of borrowing. You have to survive. That's why the government is even going about borrowing. So individuals too are allowed at this point to borrow for survival instead of borrowing for parties, for affairs, and so on like that.
Okay, as we finally wrap up this segment, what can be done to support our mental well-being during this time?
Oh, like I said, a balanced spiritual life will help. Then having a hobby that you can do at home will also help. Even if there is none that you have, simple things, play games, simple games like Ludo, Words, Monopoly with family members. It will even help to increase the ties among family members. And then proper diet. Don't just say because you have it available, you will eat it.
Okay.
If you know that something is not good for you, don't go there.
Okay. Dr. Okwonkwo.
And of course, make use of your phone to ask for help when you need to. I mean, if you find yourself slipping into depression, call for help. We have lines where you can call and let people know that you have need of emotional support and you'll be well attended to. That is another way.
Okay, Dr. Okwonkwo, we appreciate your expertise on how to achieve mental balance during this period.
Thank you very much.
We have been talking to Dr. Leonard Okwonkwo via Skype on how to cope with COVID-19. Dr. Okwonkwo is a clinical psychologist. We continue Sound Health with trending health reports. Please stay with us. It's still Sound Health on Lagos Television. I am Olasumbo Modupe. International Nurses Day is observed every 12th of May. It is celebrated around the world to honor contributions of nurses in the society. Details in this package. Well, this is where we drop the anchor of today's show. Watch your health and wellness, as well as know your stress signal during the COVID-19 era. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.